And finally, income and income support policies and programs need to continue to be reviewed to ensure they are adequate to allow Nova Scotians to afford a healthy diet. There have been significant signs of change since we started this project in 2002. For example, government has used food costing data to inform policies and programs. Since our last report in 2009, we've seen an increase in minimum wage from $8.10 an hour to $9.65 an hour as of October 2010. And recently, the Nova Scotia government has announced increases to income assistance, personal allowance rates of $15 a month. However, as we will illustrate through our food costing scenarios, a basic nutritious diet is still significantly out of reach for families living in low-income situations. Families and individuals in these circumstances are falling into a deficit to eat nutritiously, or they're just barely keeping their heads above water. Now let me put these broad statements into context by reviewing the research. The tool that our food costers used was the National Nutritious Food Basket. This is a list of 67 basic food items based on Canada's Food Guide. It's important to note that this basic, low-cost, nutritious diet does not represent an ideal diet for Canadians. We adapted this diet to households of various sizes with people of different ages and gender. We calculate the costs of shelter and other necessities in Nova Scotia, and we weighed these against income and other supports such as the child tax benefit and GST and HST benefits. While I won't review each scenario in detail, I will highlight a few. Scenario A, a family of 4 living on minimum wage. With one parent working full-time and the other working part-time for minimum wage, the cost of the basic nutritious food basket, on top of other basic necessities, would leave this family with a deficit of $84 at the end of the month. This means that they must make tough choices to either compromise the food budget or other basic expenses in order to break even at the end of the month. There's no money left in the bank for an emergency or no money for unexpected expenses. For a similar family on income assistance, so 2 parents and 2 children again, the situation is far worse. At the end of the month, they would find themselves with a deficit of $440. For this family, to choose a healthy diet is choosing to go further into debt. Scenario B, a single mother earning minimum wage. A basic nutritious diet for a lone female parent family with 3 children would cost an average of $660.84 per month. To provide this diet, the mother would experience a deficit of $448 per month. A similar family on income assistance would have a deficit of $375 at the end of the month. Scenario C is a lone parent woman in her 2nd or 3rd trimester. As a full-time minimum wage earner, the lone woman who is expecting would be left with $340 a month to cover additional expenses. But those expenses would also include the expenses associated with expecting a baby if she were to purchase a nutritious diet. This same woman on income assistance would experience a monthly deficit of $435 if she were to purchase this basic nutritious diet in her 2nd trimester. In her 3rd trimester, the woman on income assistance would be eligible for a higher shelter allowance, decreasing her deficit to about $307 a month. Nonetheless, on income assistance, she and her baby are clearly at risk of poor health outcomes due to food insecurity. The last scenario that I want to look at is a single male with no children. As a full-time minimum wage earner, the single male would be left with $298 a month to cover additional expenses. This scenario assumes, however, that he's able to find shelter for just under $560 a month. The same man on income assistance would experience a monthly deficit of $506 a month, a deficit of $506 a month if he were to purchase a basic nutritious diet. And again, this is assuming that he is also able to find shelter for just under $560 a month. He is clearly at risk for food insecurity. The impact is even greater in rural communities, where it costs on average approximately $26 more a month to purchase this basic nutritious food basket than in urban areas. To put these statistics into context, according to Statistics Canada, in 2007 in Nova Scotia, 9.3% of households, that's approximately 84,951 households, reported either moderate or severe income-related food insecurity. The rates of food insecurity reported by Nova Scotians are higher than the national average of 7.7%. Moreover, according to Food Banks Canada, in March 2010, 22,573 Nova Scotians accessed a food bank. This represents nearly 34% increase since March 2008, and remember that only about 1 in 4 people who experience food insecurity actually will go to a food bank. What this research highlights is that many families are struggling to make ends meet. Nova Scotians living in low-income situations aren't able to fully participate in society. The health and quality of life of many Nova Scotians is being put at risk. This has a negative impact on the health of our communities and, as I said, contributes to the weight on our health system. Our calculations do not consider many of the things that we all take for granted. There's no room in the monthly budget for cable television, music lessons, or joining the local soccer club. There's no allocation for education or retirement savings or planning a family vacation. There's no money left over for eyeglasses, dentist appointments, or medical emergencies. There's no budgeting for a colder than usual winter or the rising cost of fuel that we're seeing. And therein lies the impossible choices facing many families and individuals. Sacrifice one area to pay for another. Unfortunately, for many, the sacrifice is a healthy diet. It's a constant juggling act, and we hear this from the women that we work with and our partners. Low-wage earners and people on fixed incomes are struggling to meet their most basic needs. They worry from day to day about feeding their families and paying their bills. With such a limited budget, how do parents in these situations make the impossible choice between affordable and nutritious? In a few moments, Jacqueline will tell you more about her personal experience with food insecurity. But before I turn it over to Jacqueline, I do want to spend a few moments talking about the positive steps that have been taken in our province. Food security is one of 4 priority areas of Healthy Eating Nova Scotia. Partners of the Food Costing Project have worked and continue to work with others across the country to create awareness of the issue and to develop tools and to allow communities to identify the root causes and sustainable solutions for food insecurity. The Nova Scotia Food Security Network and the Mount, along with 50 other partners, has launched a CURA, Community University Research Alliance, called Activating Change Together for Community Food Security. The partners will undertake participatory action research in Nova Scotia over the next 5 years to help us understand the factors contributing to community food security and, importantly, to use this understanding to influence policy change. In 2010, citizens formed the first provincial food policy council in the country. In 2009, the Nova Scotia government released its poverty reduction strategy entitled Preventing Poverty, Promoting Prosperity. Aspects of this strategy include the introduction of an affordable living tax credit and poverty reduction tax credit, both of which were introduced in July 2010. And in April 2011, the Nova Scotia government announced several new policies to support low-income families. This includes a 22% increase per child per month to the Nova Scotia Child Benefit, the first increase in a decade, and a $15 increase per month to the personal allowance portion of income assistance.